Hi, everyone. This is Nurse Anna from nursestudy.net. Today we have 50 questions on gastrointestinal disorders. And don't forget we have study guides and free audiobooks available in our store. The links are in the description below. Question 1. A 58-year-old with cirrhosis and hematemesis arrives hypotensive. BP84/52, heart rate 126, cool and clammy. Large bore IVs are in place and oxygen via non-rebreather at 15 liters per minute. Which nursing action is the priority? A. Insert a nasogastric tube for lavage. B. Position the patient in left lateral decubitus and prepare suction. C. Administer PRN lorazepam for agitation. D. Encourage oral fluids as tolerated. Correct answer: B. Position the patient in left lateral decubitus and prepare suction. Rationale: with active upper GI bleeding and risk of aspiration, hematemesis, altered perfusion, airway protection and readiness to clear the oropharynx take priority. NG placement A is contraindicated in suspected variceal bleed due to risk of precipitating hemorrhage. Sedation, C, may worsen airway protection. Oral fluids, D, are unsafe when unstable or NPO. Question 2. A patient with acute pancreatitis has severe epigastric pain radiating to the back, lipase 2500, and calcium 7.4. Which nursing action supports the pathophysiology and reduces pancreatic stimulation? A. Advance to clear liquids as tolerated. B. Maintain NPO, start isotonic IV fluids, and use opioid analgesics per MAR. C. Administer prophylactic antibiotics. Now. D. Place patient in Trendelenburg position. Correct answer: B. Maintain NPO, start isotonic IV fluids, and use opioid analgesics per MAR. Rationale: resting the pancreas, NPO, and aggressive fluid resuscitation address, third spacing, and hypovolemia. Analgesia is appropriate within RN scope. Clear liquids: A. Stimulate pancreatic secretion. Prophylactic antibiotics, C, are not routine without infection. Trendelenburg, D, worsens respiratory mechanics and does not address pancreatitis. Question 3. A patient with ulcerative colitis reports 12 bloody stools per day, abdominal distension, fever 39.1 degrees Celsius, 102.4 degrees Fahrenheit, heart rate 132. Abdomen is tympanitic with decreased bowel sounds. Which complication should the nurse suspect and escalate immediately? A. Small bowel obstruction. B. Toxic megacolon. C. Appendicitis. D. Celiac crisis. Correct answer: B. Toxic megacolon. Rationale: fever, tachycardia, systemic toxicity, abdominal distension, and decreased bowel sounds in severe UC suggest toxic megacolon, a life-threatening emergency. The nurse should keep patient NPO, avoid bowel stimulants, initiate IV access/fluids, and urgently notify the provider. SBO, A, is less likely with UC colon involvement. Appendicitis, C, localizes to RLQ with guarding. Celiac crisis, D, is rare and not consistent with severe colitis findings. Question 4. A 72-year-old with peptic ulcer disease suddenly develops rigid abdomen, shoulder, Kier pain, and absent bowel sounds. BP 92/58, heart rate 118. Which RN action is most appropriate first? A. Administer prescribed PPIPO. B. Place the patient in PO and prepare for urgent evaluation. Maintain IV fluids. C. Encourage ambulation to relieve gas. D. Start enteral feeding at low rate. Correct answer: B. Place the patient in PO and prepare for urgent evaluation. Maintain IV fluids. Rationale: signs indicate perforation with peritonitis. The RN should keep the patient in PO, maintain IV access/fluids, obtain vitals, and promptly notify the provider for emergent evaluation. PO meds A and enteral feeds D are contraindicated. Ambulation C risks worsening instability. Question 5. A patient admitted for suspected upper G eye bleed has NG tube to low intermittent suction. Output becomes bright red with clots. Hemoglobin falls from 10.9 to 8 in 4 hours. The patient is pale and dizzy with heart rate 122. Which RN action is best now? A. Flush the NG with 200 milliliters saline to clear clots. B. Increase suction to high continuous. C. Reassess vital signs, ensure 2 patent large bore IVs, and notify the provider of active bleeding status. D. Remove the NG tube to reduce mucosal trauma. Correct answer: C. Reassess vital signs, ensure 2 patent large bore IVs, and notify the provider of active bleeding status. Rationale: worsening hemorrhage requires urgent escalation, hemodynamic reassessment, and readiness for interventions, e.g. endoscopy within RN scope. Large saline flushes risk aspiration and do not control bleeding. High continuous suction B can injure mucosa. Removing the NGD may hinder management and assessment. Question 6. A patient with Crohn's disease has a new ileostomy after small bowel resection. On postoperative day 2, the output is 1,600 milliliters of thin green effluent over 24 hours. Potassium 3.2, 2 sodium 131 milliequivalents per liter. Blood pressure 94/60, dry mucous membranes. Which RN intervention has highest priority? A. Restrict fluids to decrease output. B. Educate on odor control products. C. Initiate intravenous isotonic fluids and monitor electrolytes and urine output. D. Increase fiber in the diet today. Correct answer: C. Initiate intravenous isotonic fluids and monitor electrolytes and urine output. Rationale: early postoperative high-output ileostomy can cause dehydration and electrolyte losses, low sodium/potassium, hypotension. The RN should support volume electrolyte replacement and close I and O monitoring. Fluid restriction A worsens hypovolemia. Odor control B is not priority in instability. High fiber D is not appropriate immediately post-op, and while NPO, advancing diet per orders. Question 7. A patient with hepatic encephalopathy on lactulose presents with increasing confusion, asterixis, and ammonia, 102. The patient had 1 soft stool in 24 hours. Which RN action optimizes therapy and safety? A. Hold lactulose to prevent dehydration. B. Administer lactulose as scheduled and titrate to produce 2 to 3 soft stools per day while instituting fall precautions. C. Offer high-protein snacks to prevent catabolism. D. Place the patient on bed rest without a sitter. Correct answer: B. Administer lactulose as scheduled and titrate to 2 to 3 soft stools per day. Institute fall precautions. Rationale: lactulose reduces ammonia via catharsis. Inadequate stooling requires titration per parameters. Safety measures are essential due to confusion. Holding lactulose A worsens encephalopathy. High protein C may increase ammonia and decompensated cirrhosis. Protein moderated based on tolerance. Bed rest alone D is insufficient for fall risk. Question 8. A 69-year-old with known esophageal varices is scheduled for urgent endoscopy to evaluate melena and dizziness. Which pre-procedure RN action is most appropriate? A. Have the patient sip water to confirm swallow reflex. B. Verify NPO status, check coagulation results, establish large bore IV access, and ensure consent is obtained. C. Remove oxygen to get accurate room air saturation. D. Administer a bowel stimulant laxative. Correct answer: B. Verify NPO, check coagulation, IV access, and consent. Rationale: safe endoscopy requires airway protection, NPO, hemodynamic access, and awareness of bleeding risk, coags. Swallow testing A is irrelevant pre-sedation and risk aspiration if NPO is violated. Oxygen C should not be removed in an anemic/bleeding patient. Laxatives D are not indicated for upper GI evaluation and may worsen bleeding. Question 9. A patient treated for C. difficile colitis, profuse watery diarrhea, abdominal pain is improving clinically. Which RN infection control action is most important to prevent transmission? A. Alcohol-based hand sanitizer before leaving the room. B. Remove contact precautions when stools decrease. C. Hand washing with soap and water after glove removal and using dedicated equipment in the room. D. Place the patient on airborne precautions. Correct answer C. Hand washing with soap and water and dedicated equipment. Rationale: C. difficile spores resist alcohol. Soap and water hand hygiene is required. Contact precautions remain until criteria to discontinue are met per policy. B is incorrect. Airborne D is unnecessary. Question 10. A patient with suspected small bowel obstruction, prior surgeries, has colicky abdominal pain, bilious vomiting, and high-pitched bowel sounds. NG tube is ordered and placed to low intermittent suction. 800 milliliters green output over 6 hours. The patient reports less pain but increasing thirst and lightheadedness. Urine output is 20 milliliters per hour. Which RN action is best now? A. Clamp the NG tube to reduce fluid losses. B. Continue NG to low intermittent suction and increase IV isotonic fluids per protocol. Monitor electrolytes and urine output. C. Advance to clear liquids to maintain hydration. D. Remove the NG tube due to high output. Correct answer. B. Continue NG suction and increase IV isotonic fluids per protocol. Monitor labs and urine output. Rationale: ongoing NG losses and third spacing in small bowel obstruction cause intravascular depletion. The RN supports volume electrolyte replacement and monitoring while maintaining decompression, symptom relief, and reduced risk of aspiration. Clamping/removing A/D risks recurrent vomiting/aspiration. Oral fluids C are contraindicated during active obstruction. Question 11. A 64-year-old male with a history of chronic alcohol use presents with ascites and shortness of breath. The nurse notes taut abdominal skin, shallow respirations, and SpO2 of 90% on room air. Which nursing action should be implemented first? A. Encourage deep breathing and coughing exercises. B. Position the patient in a high Fowler's position to promote lung expansion. C. Restrict fluids immediately. D. Obtain a prescription for an indwelling urinary catheter. Correct answer: B. Position the patient in a high Fowler's position to promote lung expansion. Rationale: the ascites exerts pressure on the diaphragm, impairing ventilation. Sitting upright improves lung expansion and oxygenation. Fluid restriction C is appropriate later, but not the immediate priority. Deep breathing A is less effective while dyspneic. Catheterization D is not indicated. Question 12. A patient admitted with acute diverticulitis reports severe left lower quadrant pain and fever. The nurse notes rebound tenderness and guarding. Which RN intervention is most appropriate? A. Administer stool softeners to relieve constipation. B. Insert a rectal thermometer for temperature monitoring. C. Maintain NPO status. Administer IV fluids and monitor for signs of perforation. D. Provide a high-fiber diet to decrease symptoms. Correct answer: C. Maintain NPO status, administer IV fluids, and monitor for signs of perforation. Rationale: acute diverticulitis requires bowel rest, NPO, and supportive care. Fiber is added only after inflammation resolves. Rectal manipulation. B. Risks perforation. Stool softeners A may aggravate the inflamed bowel. Question 13. A 55-year-old patient with esophageal cancer has a new Jejunostomy feeding tube. Which nursing action is most important before administering enteral nutrition? A. Flush the tube with 200 milliliters water to check patency. B. Verify tube placement via X-ray or per protocol and confirm residual tolerance. C. Start feeding at full strength and full rate to test tolerance. D. Place the patient supine to prevent aspiration. Correct answer B. Verify tube placement via X-ray or per protocol and confirm residual tolerance. Rationale: accurate placement verification prevents aspiration and peritoneal leakage. Feeding at full rate, AB C. Risks intolerance. Large flushes. A may cause electrolyte imbalance. Supine positioning. D increases aspiration risk. Question 14. A patient post-cholecystectomy develops right shoulder pain and mild abdominal distension. Which RN intervention best addresses the likely cause? A. Ambulate the patient and encourage deep breathing. B. Apply cold compresses to the abdomen. C. Keep the patient NPO and notify the surgeon. D. Administer antiemetics only. Correct answer: A. Ambulate the patient and encourage deep breathing. Rationale: referred shoulder pain and distension often result from CO2 gas used in laparoscopy. Ambulation and deep breathing promote gas reabsorption and relieve discomfort. NPO, C, or cold compress, B, does not resolve gas-related pain. Question 15. A patient with a history of peptic ulcer disease reports sudden severe epigastric pain and vomiting blood. The nurse notes rigid abdomen and hypotension. What is the priority RN action? A. Administer an antacid suspension orally. B. Keep the patient NPO and notify the provider immediately. C. Insert a rectal thermometer to check temperature. D. Offer sips of water for comfort. Correct answer: B. Keep the patient NPO and notify the provider immediately. Rationale: the symptoms suggest a perforated ulcer and emergency. NPO status prevents further peritonitis risks. Oral medications or fluids are contraindicated. Rectal insertion may cause injury. Question 16. A 32-year-old patient presents with severe right lower quadrant pain, rebound tenderness, and WBC 16,000. Appendicitis is suspected. Which nursing action is contraindicated? A. Maintaining NPO status. B. Applying an ice pack to the abdomen. C. Administering prescribed intravenous fluids. D. Applying a heating pad to relieve pain. Correct answer: D. Applying a heating pad to relieve pain. Rationale: heat increases circulation and may cause appendix rupture. Cold packs and NPO are safe. IV fluids maintain hydration while awaiting surgery. Question 17. A patient with acute gastroenteritis is receiving 0.9% NSIV at 125 milliliters per hour. The nurse notes dry mucous membranes, confusion, and serum sodium of 151 milliequivalents per liter. Which intervention is most appropriate? A. Continue isotonic fluids and monitor neurological status closely. B. Change to D5W at 200 milliliters per hour immediately. C. Restrict all fluids to correct hypernatremia. D. Increase sodium intake through diet. Correct answer: A. Continue isotonic fluids and monitor neurological status closely. Rationale: hypernatremia from dehydration is corrected gradually with isotonic fluids to prevent cerebral edema. Rapid hypotonic fluid administration can cause fluid shifts. Sodium intake should not be increased. Question 18. A patient with liver cirrhosis develops ascites and confusion. Labs: sodium 128, potassium 3.1, and ammonia 95. The nurse anticipates which provider order and intervention. A. Administer IV potassium and lactulose. Monitor for improved mentation. B. Restrict protein to 10 grams per day. C. Increase sodium intake to counter hyponatremia. D. Stop all laxatives immediately. Correct answer. A. Administer IV potassium and lactulose. Monitor for improved mentation. Rationale: hypokalemia and elevated ammonia exacerbate hepatic encephalopathy. Potassium correction and lactulose therapy aid ammonia elimination. Sodium restriction, not increase, and moderate protein are indicated. Question 19. A patient with acute pancreatitis is receiving IV fluids and has a nasogastric tube on low intermittent suction. The nurse notes decreased pain and NG output, but the patient suddenly develops fever, leukocytosis, and worsening abdominal tenderness. What should the nurse do first? A. Document findings and continue monitoring. B. Administer PRN opioids for pain relief. C. Notify the provider, suspect pancreatic abscess formation. D. Advance to a clear liquid diet. Correct answer. C. Notify the provider, suspect pancreatic abscess formation. Rationale: new fever and localized tenderness after initial improvement indicate possible abscess or infected necrosis. Serious complications. Early notification enables prompt diagnostic imaging and management. Question 20. A patient with celiac disease is admitted for nutritional assessment. Which statement indicates the need for further teaching? A. I avoid bread and pasta made from wheat. B. I use oats that are labeled gluten-free. C. I eat barley soup because it's low in fat. D. I check food labels for hidden gluten ingredients. Correct answer. C. I eat barley soup because it's low in fat. Rationale: barley contains gluten and must be avoided. Oats labeled gluten-free, B, are generally safe. Avoidance of wheat and label checking, AD, demonstrate correct understanding. Question 21. A patient with newly diagnosed ulcerative colitis is prescribed mesalamine, 5-aminosalicylic acid. Which RN teaching point is most important? A. You should stop the medication if mild abdominal cramping occurs. B. Report any signs of bloody diarrhea or fever to your healthcare provider. C. Expect your urine to turn orange-brown while taking this medication. D. Take the medication on an empty stomach with water. Correct answer: B. Report any signs of bloody diarrhea or fever to your healthcare provider. Rationale: fever and bloody diarrhea may indicate worsening colitis or mesalamine-induced toxicity. Mild cramping A is common and not usually a reason to stop therapy. Orange urine C occurs with rifampin, not mesalamine. Mesalamine can be taken with food to decrease GI upset. D. Question 22. A patient presents with jaundice, pruritus, and dark urine. Labs: total bilirubin 8.2 milligrams per deciliter, alkaline phosphatase elevated. Which nursing intervention best supports the pathophysiology? A. Provide a high-fat diet to increase bile flow. B. Encourage oatmeal baths and apply lotion to relieve itching. C. Administer a laxative to promote bowel movement. D. Apply heat packs to the right upper quadrant. Correct answer: B. Encourage oatmeal baths and apply lotion to relieve itching. Rationale: cholestasis causes bile salt accumulation, leading to skin irritation and pruritus. Comfort measures reduce scratching and skin injury. High-fat diets worsen symptoms, and heat is contraindicated over the liver. Question 23. A 68-year-old with gastric cancer is receiving total parenteral nutrition, TPN, via central line. The nurse notes blood glucose of 248 and redness at the catheter site. Which action is priority? A. Decrease TPN rate by half. B. Assess for infection and notify the provider immediately. C. Flush line with saline and continue infusion. D. Stop TPN abruptly and remove the line. Correct answer. B. Assess for infection and notify the provider immediately. Rationale. Redness at the central line site indicates possible infection. TPN supports bacterial growth, so early assessment and notification are essential. TPN should never be abruptly stopped. Risk of hypoglycemia. Question 24. A patient with hepatic cirrhosis reports black tarry stools and weakness. Vitals: BP 88/54, heart rate 128. Which nursing action should be performed first? A. Check stool for occult blood. B. Prepare to administer lactulose. C. Place the patient in supine position and notify the provider. D. Assess airway and place the patient in high Fowler's position with oxygen. Correct answer. D. Assess airway and place the patient in high Fowler's position with oxygen. Rationale. The patient shows signs of hypovolemic shock from GI bleed. Airway and oxygenation are the immediate priorities before other interventions. Question 25. A 47-year-old patient is diagnosed with acute viral hepatitis A. Which teaching should the nurse emphasize? A. Avoid contact with others for at least 6 months. B. Wash hands thoroughly after using the bathroom and before eating. C. You can donate blood after recovery. D. Chronic infection is likely to develop. Correct answer. B. Wash hands thoroughly after using the bathroom and before eating. Rationale. Hepatitis A is transmitted via the fecal-oral route. Hand hygiene prevents spread. Chronic infection and blood donation are not applicable. Question 26. A patient with chronic pancreatitis is receiving pancreatic enzyme replacement. Which finding indicates the medication is effective? A. Decreased stool fat content and improved weight maintenance. B. Dark tarry stools and abdominal pain relief. C. Increased appetite and bloating. D. Constipation and hard stools. Correct answer. A. Decreased stool fat content and improved weight maintenance. Rationale. Effective enzyme therapy improves fat absorption, reducing steatorrhea and promoting weight stability. Tar-E stools suggest GI bleed. Question 27. A patient with Crohn's disease reports abdominal pain, fever, and a palpable mass in the right lower quadrant. Which complication should the nurse suspect? A. Fistula formation. B. Abscess formation. C. Toxic megacolon. D. Strangulated hernia. Correct answer. B. Abscess formation. Rationale. Localized tenderness, fever, and mass indicate abscess formation from transmural inflammation. Fistulas may form later. Toxic megacolon presents with distension and systemic toxicity. Question 28. A 58-year-old with colorectal cancer undergoes colectomy with colostomy formation. On postoperative day 3, the stoma appears dusky and cool to touch. What is the priority nursing action? A. Document the finding as normal for early postoperative period. B. Apply a warm compress and reassess in 1 hour. C. Notify the surgeon immediately. D. Clean the stoma with hydrogen peroxide and reapply pouch. Correct answer. C. Notify the surgeon immediately. Rationale. A dusky, cool stoma indicates ischemia or necrosis, an urgent surgical emergency. Warm compresses and hydrogen peroxide are contraindicated. Question 29. A patient with gastric bypass surgery reports dizziness, tachycardia, and abdominal cramping after eating sweets. Which teaching should the RN provide? A. Drink fluids with your meals to aid digestion. B. Lie down after meals to reduce discomfort. C. Eat small, frequent meals high in protein and low in sugar. D. Avoid all solid foods for the next 2 weeks. Correct answer. C. Eat small, frequent meals high in protein and low in sugar. Rationale. Symptoms reflect dumping syndrome. Dietary modification prevents rapid gastric emptying. Lying down, B, can help, but diet change is key. Question 30. A patient with portal hypertension develops esophageal varices. The nurse should question which provider order. A. Propranolol, 10 milligrams by mouth daily. B. NG tube insertion for gastric love vase. C. Soft diet with no irritants. D. Monitor hemoglobin and hematocrit. Correct answer. B. NG tube insertion for gastric lavage. Rationale. NG tube insertion may rupture varices and cause massive bleeding. Beta blockers. A. Reduce portal pressure. Soft diet. C. Prevents trauma. Monitoring labs. D. Tracks bleeding status. Question 31. A 62-year-old with peptic ulcer disease is receiving continuous pantoprazole IV infusion. Which parameter is most important for the nurse to monitor? A. Blood glucose levels every 4 hours. B. Bowel sounds and abdominal distension. C. Magnesium level and signs of muscle weakness. D. Skin turgor and mucous membranes. Correct answer. C. Magnesium level and signs of muscle weakness. Rationale. Long-term proton pump inhibitor therapy can cause hypomagnesemia, leading to muscle weakness or arrhythmias. Monitoring electrolyte trends is essential. Dehydration and bowel sounds are secondary concerns. Question 32. A patient with ulcerative colitis is started on corticosteroid therapy. Which nursing instruction is most appropriate? A. Stop the medication if you gain weight. B. Take this medication with food and do not discontinue abruptly. C. Avoid all forms of dairy while taking this medication. D. You may skip doses on days you feel well. Correct answer. B. Take this medication with food and do not discontinue abruptly. Rationale. Steroids must be tapered gradually to prevent adrenal crisis and should be taken with food to minimize gastric irritation. Question 33. A patient with liver cirrhosis has ascites and is receiving spironolactone. Which finding should the nurse report immediately? A. Mild dizziness when standing. B. Serum potassium 5.8 milliequivalents per liter. C. Weight loss of 1 pound in 24 hours. D. Urine output of 1,200 milliliters per day. Correct answer. B. Serum potassium 5.8 milliequivalents per liter. Rationale. Spironolactone is a potassium-sparing diuretic. Hyperkalemia is life-threatening and requires provider notification. Question 34. A patient post-ERCP develops severe epigastric pain radiating to the back and elevated amylase/lipase. Which complication should the nurse suspect? A. Perforated duodenal ulcer. B. Pancreatitis. C. Biliary obstruction. D. Cholangitis. Correct answer. B. Pancreatitis. Rationale. ERCP can precipitate acute pancreatitis. The hallmark is severe upper abdominal pain radiating to the back with enzyme elevation. Question 35. A patient with short bowel syndrome is receiving long-term parenteral nutrition. Which nursing intervention helps prevent hepatic complications? A. Use lipid-free TPN continuously over 24 hours. B. Cycle TPN over 12 to 16 hours and monitor liver enzymes. C. Administer TPN at maximum glucose concentration. D. Avoid checking blood glucose levels. Correct answer. B. Cycle TPN over 12 to 16 hours and monitor liver enzymes. Rationale. Cyclic TPN reduces liver stress and cholestasis risk. Monitoring AST/ALT prevents hepatic injury. Question 36. A 48-year-old with GERD reports chronic cough and hoarseness. Which teaching is most effective? A. Lie down immediately after eating. B. Eat small, frequent meals and avoid late-night snacks. C. Drink peppermint tea after meals. D. Increase carbonated beverage intake to reduce acid. Correct answer: B. Eat small, frequent meals and avoid late-night snacks. Rationale: lifestyle modification, meal timing, portion size, head elevation decreases reflux. Peppermint and carbonation aggravate LES relaxation. Question 37. A patient with advanced cirrhosis has asterixis and confusion. Which nursing intervention has highest priority? A. Apply restraints to prevent falls. B. Restrict all protein to zero intake. C. Maintain safe environment and assess ammonia-lowering therapy adherence. D. Encourage strenuous ambulation for circulation. Correct answer: C. Maintain safe environment and assess ammonia-lowering therapy adherence. Rationale: safety and evaluation of lactulose therapy are priorities in hepatic encephalopathy. Total protein restriction is outdated. Question 38. A patient with inflammatory bowel disease is prescribed infliximab Remicade. Which assessment is most critical before administration? A. Assess for recent infections or fever. B. Check for constipation. C. Determine fasting blood glucose level. D. Evaluate dietary fiber intake. Correct answer: A. Assess for recent infections or fever. Rationale: infliximab suppresses immunity. Active infection must be ruled out before infusion to prevent sepsis. Question 39. A 72-year-old with chronic constipation due to opioid use is prescribed lactulose. Which outcome indicates effective therapy? A. 2 soft stools per day without cramping. B. Watery diarrhea and dehydration. C. Formed hard stool every 3 days. D. Absence of bowel movement for 24 hours. Correct answer: A. 2 soft stools per day without cramping. Rationale: lactulose draws water into the bowel. Moderate stooling without electrolyte loss reflects effectiveness. Question 40. A patient with esophageal variceal bleeding is receiving octreotide infusion. Which parameter best indicates the medication's effectiveness? A. Reduced portal venous pressure and decreased bleeding. B. Increased urine output and improved appetite. C. Elevated heart rate and blood pressure. D. Decreased serum ammonia levels. Correct answer: A. Reduced portal venous pressure and decreased bleeding. Rationale: octreotide decreases splanchnic blood flow, lowering portal pressure and controlling variceal bleeding. It does not directly affect ammonia. Question 41. A patient with end-stage liver failure is admitted with severe ascites. Which nursing action best promotes comfort and respiratory function before paracentesis? A. Encourage high-protein meals. B. Place the patient in a high Fowler's position. C. Apply an abdominal binder tightly. D. Restrict oxygen to prevent dependency. Correct answer: B. Place the patient in a high Fowler's position. Rationale: sitting upright maximizes diaphragmatic excursion and eases breathing. Tight binders increase intra-abdominal pressure, and high protein may worsen hepatic encephalopathy in some cases. Question 42. A 70-year-old patient develops coffee ground emesis after long-term NSAID use. Which nursing intervention is the priority? A. Assess blood pressure and heart rate. B. Administer an antacid. C. Offer clear fluids for hydration. D. Encourage ambulation. Correct answer: A. Assess blood pressure and heart rate. Rationale: GI bleeding can lead to hypovolemic shock. Early detection of hemodynamic instability is crucial. Antacids are not appropriate during active bleeding. Question 43. A patient with acute pancreatitis is receiving intravenous morphine. The nurse notices shallow respirations and oxygen saturation of 88%. What should the nurse do first? A. Stop the morphine infusion and notify the provider. B. Administer naloxone per protocol. C. Place the patient in a side-lying position and apply oxygen. D. Encourage incentive spirometry. Correct answer, C. Place the patient in a side-lying position and apply oxygen. Rationale: maintaining airway and oxygenation is the immediate priority. Naloxone may follow if symptoms persist, but oxygenation and positioning are first. Question 44. A patient with portal hypertension and ascites is prescribed furosemide and spironolactone. Which finding requires immediate nursing intervention? A. Weight loss of 2 pounds in 24 hours. B. Serum potassium of 6.0 milliequivalents per liter. C. Increased urine output. D. Abdominal girth decrease of 1 inch. Correct answer, B. Serum potassium of 6.0 milliequivalents per liter. Rationale: hyperkalemia is a dangerous complication of spironolactone and can cause cardiac dysrhythmias. Prompt provider notification is required. Question 45. A patient post-gastric surgery develops nausea, diaphoresis, and dizziness 20 minutes after eating. What teaching should the nurse reinforce? A. Eat large, high-fat meals to slow digestion. B. Lie down after eating and avoid sugary foods. C. Drink fluids with each meal. D. Eat while standing to reduce fullness. Correct answer, B. Lie down after eating and avoid sugary foods. Rationale: the patient is experiencing dumping syndrome. Small, protein-rich meals and reclining after eating reduce symptoms. Fluids should be taken between meals, not with them. Question 46. A patient with suspected bowel perforation has sudden severe pain, rigid abdomen, and absent bowel sounds. Which provider order should the nurse question? A. NPO and nasogastric decompression. B. Administer morphine IV for pain. C. Administer laxatives for constipation. D. Begin IV broad-spectrum antibiotics. Correct answer, C. Administer laxatives for constipation. Rationale: laxatives are contraindicated with perforation. They increase intra-abdominal pressure and leakage risk. Pain control and antibiotics are appropriate. Question 47. A patient with Crohn's disease is receiving infliximab infusion. 30 minutes into the infusion, the patient develops shortness of breath and facial swelling. Which action is priority? A. Slow the infusion rate. B. Administer prescribed antihistamine. C. Stop the infusion and maintain airway with oxygen. D. Document the findings and continue monitoring. Correct answer, C. Stop the infusion and maintain airway with oxygen. Rationale: the reaction suggests anaphylaxis. The infusion must be stopped immediately and airway management initiated before giving medications. Question 48. A patient with cirrhosis has been prescribed lactulose. Which outcome best indicates therapeutic effectiveness? A. The patient reports increased appetite. B. The patient passes 2 to 3 soft stools daily and mental status improves. C. Serum sodium levels rise. D. Urine output increases. Correct answer, B. The patient passes 2 to 3 soft stools daily and mental status improves. Rationale: lactulose lowers serum ammonia via increased stool excretion. Improvement in mentation reflects successful therapy. Question 49. A patient with irritable bowel syndrome, IBS, reports alternating diarrhea and constipation with bloating. Which dietary teaching is most appropriate? A. Increase your intake of caffeine and spicy foods. B. Eat a low residue, high fat diet. C. Increase soluble fiber and drink plenty of water. D. Avoid all carbohydrates. Correct answer, C. Increase soluble fiber and drink plenty of water. Rationale: soluble fiber normalizes stool consistency and hydration supports bowel motility. Caffeine and fat exacerbate IBS symptoms. Question 50. A patient with upper GI bleeding has a nasogastric tube placed. Which nursing assessment finding warrants immediate intervention? A. Small amount of pink-tinged output. B. Decrease in hemoglobin from 10 to 8. C. Sudden bright red output of 400 milliliters. D. Patient reports mild epigastric discomfort. Correct answer, C. Sudden bright red output of 400 milliliters. Rationale: active bright red bleeding suggests rebleeding or uncontrolled hemorrhage. Immediate notification and stabilization are required. This concludes our GI test exam. Visit us at nursestudy.net for more care plans and patho.